The role of speech and swallowing therapist is to treat and manage the speech and swallowing difficulties before, during and after treatment for oral cancers. The journey is tough. It often involves the involvement of surgery, radiation therapy and chemotherapy that creates a profound impact on speech and swallowing difficulties, leading to altered communication, malnutrition, social isolation and reduced quality of life. So it affects the way patient eats with his family, the way he eats at social gatherings. So overall, there are even a bigger set of problems that may occur even after they have been treated successfully for oral cancers. There can be a lot of issues during, before and after the treatment, and therefore you require to visit a speech and swallow therapist during this time. So why exactly should a patient see the speech and swallowing therapist before beginning the treatment? There are two important reasons for the same. So first is to understand what can possibly happen during the treatment. So radiations can cause a lot of inflammation, tenderness, swelling. Mucositis can occur wherein there can be sores in the mouth. When the saliva becomes really thick and sticky, the most important thing is the oral hygiene. The saline gargles really help a lot in reducing the thick secretions and helps improving a lot in swallowing. The second reason was to start exercising, and therefore the speech and swallow therapist will help providing you special techniques and exercises to overcome these difficulties. The difficulties in swallowing can lead to choking and aspiration that happens when the food or liquid passes down the vocal cords, goes into the trachea, that is our windpipe, and eventually goes into the lungs, putting the patient at risk of pneumonia. To reduce all of these risks, the exercises are important to start even before the treatment starts. Now the goal of swallowing therapy is to strengthen the muscles involved in swallowing and to ensure safe swallowing. Diet modifications are also required to be done, and therefore a collaborative work of clinical nutritionist and speech and swallow therapist is required to ensure safe swallowing and to ensure the optimal recovery of the patients. With the help of proper exercises and techniques, the patient can learn proper tongue movements, lip movements, jaw movements, improved articulation, and hence regain the ability to speak clearly. After the treatment for oral cancers is over, so the patient requires to continue the speech and swallow therapy at home also. Rehabilitation of speech and swallowing is not a one-time process, so it involves the continuation of therapy even at home also. Therefore, they require to continue it and visit the speech and language therapist frequently after the treatment. With the help of speech and swallow therapist, the patient can come back to the normal life as early as possible, hence improving the quality of life even after the cancers have been successfully treated.